Welcome, everyone, and thank you for joining us today for week one of Osteoporosis Canada's Summer Activities webinar series. This week, we will be focused on racket sports. Before we begin today's webinar, Osteoporosis Canada acknowledges the land that our offices, located in Toronto, are on, is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. My name is Tracie Napoli, Director of Fund Development and MARCOM at Osteoporosis Canada, and I will be your webinar host. This month, we are hosting a Summer Activities webinar series focusing on different types of exercise and sports. Participation in organized sports is a great way to enjoy staying active and enjoying the outdoors during the warmer months. Each 30-minute webinar will provide a review of what your exercise plan should include and will answer questions about the summer activities and sports featured in each webinar for those who have osteoporosis and may need to make modifications or choose a different way to stay active entirely, depending on their condition. This webinar will provide general information and is not intended, and is not intended as individualized health advice. If you have questions, please consult your healthcare provider. Now, during the webinar, we would love to hear from you. So if you have a question, you can enter it in the Q&A, which is at the bottom of your screen. Just click the icon, or you can put comments into the chat. We will do our best to answer as many questions related to the webinar topic as we can within the time available. Osteoporosis Canada is the only national organization serving people affected by osteoporosis, working to educate, empower, and support individuals and communities on bone and muscle health and the risk reduction and treatment of osteoporosis. We look to the best experts to inform our care guidelines for patients and care providers. Our Scientific Advisory Council is made up of experts from across the country in osteoporosis and bone metabolism and is a volunteer membership. Part of what we do is to provide medically accurate information to patients, healthcare providers, and the public. For more information, please visit the website. It's now my pleasure to introduce our speaker today, Dr. Caitlin McArthur, who is an associate professor in the School of Physiotherapy at Dalhousie University and principal investigator of the 3F Research Group. She completed a Bachelor of Science in Kinesiology, a Master of Science in Physiotherapy, and a PhD in Kinesiology with a specialization in aging, health, and well-being. Dr. McArthur also completed a postdoctoral fellowship at the Jarrah Center for Aging Research within the Department of Medicine at McMaster University. With a passion to improve mobility and quality of life of clinically complex older adults, Dr. McArthur is a lead instructor of the continuing education course BoneFit, hosted by Osteoporosis Canada, which teaches exercise professionals about safe movements, physical activity, and exercise for people with osteoporosis. Dr. McArthur is also an Inter-RAI Fellow. It's my pleasure now to hand things over to Dr. Caitlin McArthur. Thank you.
All right, thank you so much for that introduction. I'm just going to share my screen here and get us started. So thanks everybody for joining us today to talk about racket sports. And we'll just dive right into the presentation. So here's a quick overview of what we're going to talk about today. So we'll go over some overall recommendations for exercise and physical activity, general safety tips, and then we'll jump into some specific recommendations for racket sports. So just an important note before we start of how to kind of think about this information. So some of the activities we're going to be talking about today and in subsequent presentations in this series could be risky and could have a high risk for fracture. So how you want to think about this is if this is an activity you used to do frequently or you are already doing, we're giving you tips on how to continue to do it safely or maybe restart If you've never done this activity, we're not suggesting this is something you should take up or, dive right into. And if you're uncertain, you don't really know where to go from here, you should always consult with somebody, for example, like a physiotherapist who's bone fit trained, about your individual risk level and the risks and benefits of doing the activity that you're interested in. So a little bit more about BoneFit. It was already mentioned in the introduction, but BoneFit is an exercise training workshop designed for health and fitness professionals to learn about effective and appropriate exercise for people with osteoporosis. You can find somebody who's BoneFit trained near you by looking at the locator map on our website, bonefit.ca, or you can call the number here and get some individualized advice for yourself. So how I want you to kind of think about what we're going to talk about today is there's three different kind of circles of movement or types of movement that we're going to be talking about. So first, we're going to be talking about formal exercise. So this is things like scheduled exercise where you're doing things like balance exercises, you're lifting weights, using weight machines or resistance bands. Maybe you're walking on a treadmill or doing posture exercises. Then there's movement that comes in the form of daily activities. So things like cleaning, doing the laundry, dishes, vacuuming, sweeping, gardening, mowing the lawn, getting in and out of bed or chair, sitting or standing at work. And then there are leisure activities, which are primarily the focus of this series of webinars. So things like sports, hiking, walking, biking, and swimming. So really, we're going to be talking about formal exercise and leisure activities today, and not as much about daily activities. So what's really important is that you want to make sure you have kind of the foundation laid for any other leisure activity that you want to do. The foundation being that formal exercise. So you want to make sure that your formal exercise includes balance and functional training 2 or more times per week. And these are things that challenge your balance essentially. So things like shifting your body weight, moving back and forth or side to side. Reacting to things that upset your balance. So things like throwing and catching a ball. We're going to be talking about racket sports. That's actually you're reacting to something that's upsetting your balance. You're trying to hit a ball that's moving, or a birdie. Maintaining your balance while moving. So things like Tai Chi, for example, are really great balance exercises. Or reducing your base of support. So this would be things like standing on one foot or standing on a line. And then functional training, so that was balance training. Functional training are exercises that improve everyday tasks or activities for fun and fitness. So this could be things like practicing standing up out of a chair if that's difficult for you, or stair climbing is another example of functional training. So you also want to make sure that you're including progressive resistance training in your formal exercise programs. This should be done 2 or more times per week as well. You want to target major muscle groups. So things like, your upper body, your lower body, your quadriceps, your hamstrings, those types of things, as well as abdominal and back extensor exercises. And again, if you want specific advice about this, that's where it's really great to work with somebody who's bone fit trained who can help you set up an exercise program for yourself. Progressive resistance training exercises are those that work against resistance. So this could be just your own body weight. For example, doing squats without holding any weight. Maybe you're moving dumbbells and using those as the resistance. You could be using a weight machine, or you could even be using exercise bands. So there's lots of different ways to move against resistance. And again, if you want specific recommendations, it's always best to get that individualized information. So leisure activities should be, if they can be done safely, then they could be continued to be done. So leisure activities like the racket sports we're going to be talking about, if you can definitely continue to do them, if they can be done safely or modified for safety. And what's really important, kind of a main key thing, takeaway today, is that these leisure activities should be done in addition to, but not instead of, that balance, functional, and resistance training. So that's what I meant by you really want to make sure you have that foundation. You're doing your balance, functional, and resistance training first. Once that's in place, then adding those leisure activities on top of that. So in addition to, but not instead of. So in terms of what's the movements that can be risky within our leisure activities or within our day-to-day activities, really want to think about our spine because that's where a lot of the fractures that happen during daily activities can happen. So we want to limit spine movements or back movements that put us into a forward flex position or a twisting position that are repeated or sustained. So you're either holding it for a long period of time or you're doing it over and over, or it's weighted. So you're holding something heavy while you're doing it, or it's end range. That means you're going as far as you can. You're reaching as far forward as you can, or you're rotating as far left to right as you can. It's rapid or forceful. So you're like pushing yourself really hard, you're going really fast, or any combination of those. So again, it's the forward bending and the twisting or slouching that we want to try to reduce. So we'll talk about specifically how those come into play in racquetball sports in a moment. How we can modify them are doing things like a hip hinge, which I'll give an example in a moment of how to do that. But basically moving through your hips rather than through your spine, stepping to turn instead of rotating through your spine, moving your feet instead, maybe avoiding lifting or lowering to the floor or using tools to help you do that better, doing it slow, controlled, and not to the end of range of motion. If you do have to lift something heavy, splitting it up so that you're balancing loads on either side of your body, supporting your trunk when you're bending forward. So putting a hand on your knees or on your or on a table or on a bench can help you. And then holding weight close to your body and not overhead. So here's an example of what a hip hinge looks like. This is using a dowel to kind of help show what that having that straight spine looks like, but essentially you're moving through your hips instead of through your spine. Here's an example of how you kind of apply that to activities rather than, just bending at your hips, but for example, tying your shoes in a couple different ways, picking something up from the floor, and we'll talk about a few others. So in general, when you're thinking about your leisure activities, so we're going to be talking about racket sports today briefly, you want to think about 3 different things that you might need to modify or be able to do safely. So first, you want to think about transitions. So transitions are things like, how do you get your shoes or gear on and off? How do you pick up or load your gear? How do you pick things up off the ground? So in racket sports, we're going to talk about picking up a ball or a birdie off the ground because you do that multiple times. And then getting in and out of risky positions. You also want to think about the movement, the actual thing that you're doing. Does it require spine sparing and can it be modified? So we're going to talk about racket sports with the swing. That's rapid, repetitive rotation. So how can that be modified? And then you also want to think about the risk of falling because a lot of fractures can happen from falls as well. So what is the risk of falling within this leisure activity? So specific to racket sports, let's talk about what are some potentially unsafe movements and what we can do. So the first one is picking up that ball or birdie. It happens multiple times throughout your game. You have to bend over and pick it up. So you're repetitively flexing and you might be going to end range. So we want to try to minimize that. So how we can do that, we can use hip hinge or modified golfer's reach, which is what you see on the left-hand side. This woman is putting her feet in kind of a stride stance. She's using something, this could be your racket, for example, or a pole or a bench to support her trunk. And then she's bending at her hips, not at her spine, to pick something up off the floor. And you can also really bend through your knees to achieve that as well. If that's not, possible, not comfortable, not going to work for you, you can also use something called a ball retriever, which you see here on the right, which essentially is like a pole which either has like a suction cup on the end or something sticky. So you can use that to then grab your ball, and then you don't have to bend down at all. You just grab your ball with that, and then you pick it up and get your ball and keep on playing. So again, these transitions, these middle movements are sometimes the things that are risky, not necessarily the actual activity. So here's again an example of how to pick something up using that hip hinge, really bending through the spine rather than flexing all the way forward. And, it might not be the one time that you do it that's the problem. It's the multiple times that you do it throughout a game, and then the multiple games that you play throughout the week or throughout the month that add up over time. The other potentially unsafe movement is that swing. So as I mentioned, when you're swinging, you may be doing repeated rapid end range spinal rotation. And again, you're doing it over and over throughout your game. So the modification here is you want to try to move as much through your legs and hips, which is actually probably going to give you a better swing anyways, than through your spine. So really use that rotation through your hips, through your legs to achieve the rotation rather than through your spine. The other thing that can be potentially unsafe is running to catch the birdie or the ball. And this could be a danger because if you're like really running to get after that ball, you're reaching, you're like just desperate to hit it because you really want to win the game. This could lead to a risk of tripping, which could increase your risk for falls and therefore fractures. So how you want to modify this is you want to frame the game as more for enjoyment and less for competition. So this can be hard. You kind of have to leave your ego at the door, really slow down the pace, think, I'm here to have fun, I'm here to get some activity. It's okay. Maybe I can let a ball or two go, slow it down. You also want to focus on how your feet are moving while you're running. So, not just focusing on, I need to get to the ball, I need to win. Focus on what your feet are doing so that you are not going to be tripping over them. Think about where they're going and how they're moving to keep you upright. The other thing that you can do is practice reaction drills with your partner. And what's really nice is this is actually, as I mentioned earlier, a great balance challenge as well. So it can become part of your formal exercise while also being your leisure exercise. So practice with your partner doing some reaction drills where you have to, run a little bit and react to where the ball is going or where the birdie is going or whatever racket sport you're playing so that you practice that and then put it into a competition type scenario where you're playing against somebody and you're really focused on winning. So just to kind of summarize for you, the exercise for bone health piece, you really want to make sure that balance, functional, and resistance training are part of your exercise plan. You've got that foundation covered so that you make sure that that's the part that's going to be most important for you. And then you also want to practice those spine-sparing strategies throughout your daily life and activities and apply them to the leisure activity that we're talking about today, racket sports, but the other ones that we're going to talk about in the coming weeks. Generally, you want to think about the risk for falling. So are you going to be tripping? Are you going to be, what's going to happen that could increase your risk for falls, as well as the movements and transitions. So that's it for the formal presentation, and I'm happy to answer some questions now. Maybe I'll stop sharing.
That's great, Caitlin. Thank you so much. I do have a couple of questions. I do want to touch on one point, and if you could just kind of speak to it, the importance of good footwear, appropriate footwear, good fitting footwear to make sure we're not just wearing whatever,
Yes.
something comfortable and worn in. Can you speak a little bit to that?
Yeah, definitely. So yeah, footwear is going to be really important again for that risk of tripping or falling. So you want to wear something that's, non-slip. So you're not gonna be running and then slip and fall while you're running. That provides you that good traction. And that is closed toe and has a heel and does up, so no like flip flops or like slipper type shoes or like even slip-on shoes. You want to make sure that something you can tie up pretty snug and tight. It's not going to fall, it's good fitting, it's not you got a lot of room at the end that you're going to trip over or anything like that, and it's not going to slip on the whatever surface you're on, whether you're outdoors or indoors. So keeping that in mind as well.
Great. And we have some time for some questions that we've got. So there are many different types of racket sports, pickleball, tennis, squash, racquetball, badminton, etc. Are some better for than others for someone maybe who's already fractured, has osteoporosis? Are there some that someone should avoid, or really these are strategies that just apply to all of them?
Yeah, so really these are strategies that apply to all of them. I think the probably the biggest thing is what I was talking about with you checking your ego at the door. And I know, for example, pickleball, just talking to people who play pickleball can be quite competitive and people get like really into it and really want to win. Likewise, squash is another game that I know people it can get quite intense. So those ones might be a little bit more risky if you're not kind of willing to step back a little bit, because I think that's where fractures and accidents happen a lot is when people are just they really want to win and they start doing risky things or silly things that they might not have done if they weren't like I have to win kind of situation. So I think it's more, apply these scenarios across all of them, but you have to become more mindful of how you're moving, regardless of which racket sport you're playing, and kind of check your ego and go in with a mindset of I'm here to have fun and move my body, not I'm here to crush my opponents.
Win the trophy. So,
Yeah.
well, we kind of on pickleball. So there's someone who's asked us a question. They would very much like to participate, but they've broken their wrist in the past. If you've had a wrist fracture, is this, and maybe not just for pickleball, but is this maybe something you should avoid?
So I would again make sure you've really laid that foundation and done some good foundational work before either picking it back up or starting. So working with somebody to get comfortable with your balance, comfortable with like reacting to the ball, reacting to the scenario kind of playing around you before you kind of like jump into a game scenario. So I wouldn't say it's completely off the table, but you want to make sure that you've laid that really good foundation. You feel like comfortable with your balance. You feel like you can react to a situation without losing your balance and falling. Having a wrist fracture does make you at least at moderate risk for future fracture. So you would want to start thinking about, are these activities that I really want to do? If they are, just making sure that you've laid that good foundation, you've got your balance kind of taken care of, you feel confident and strong going into it.
Okay, great. We have time for a couple more questions. Somebody's just asked, should they wear hip protectors if they're playing? I'm not sure what you.
Yeah, so there's no real evidence about hip protectors. I think anecdotally they may help. It really depends on the type that you wear and that you're wearing them properly. That's what the best evidence kind of tells us. The best evidence we have is actually from in long-term care, which is obviously a very different scenario than pickleball or squash or what have you. But they can prevent fractures if they're worn properly and they are worn like in the right place. Um, but I wouldn't say we have any good evidence from the literature related to sports specifically. It's more kind of extrapolating from other scenarios. So uh, again, I would make sure like you have that foundation kind of down in terms of your balance and your strength. And then if you feel comfortable and you want to wear them, I don't think there's necessarily a problem with wearing them. They're not going to stop you from falling. What they're going to do is if you do fall on your hip, they may decrease the risk of hip fracture. Um, so you kind of have to think about it that way. You may still fall, and there's other bones you can break if you fall too, not just your hip. You could break your wrist, you could break an arm, you could break other parts of your body. So yeah.
Absolutely. Absolutely. No, that's great. Now, you alluded to this at the beginning of the webinar, if you haven't ever played any of these sports, but there's someone who's saying, well, what if I played them many years ago? I'm in my 70s, but I haven't played for many years. Would it be something that, since I had some experience, could I pick it up again? Or is it advisable, or what would be the best option to start?
Yeah, so I think, we always want to encourage people to be active. So if you're looking to get back into something you did before and you really enjoyed it, then I think that's a great thing to do. Um, I would say again, you want to make sure you lay that good foundation of make sure that your balance and your strength is taken care of, and ease back into it. So again, don't jump into that super competitive pickleball league. Start with something a little bit slower paced, a little bit easier. Do some practice drills and kind of ease your way back into it.
That's great. Caitlin, thank you so much. Dr. McArthur, thank you so much. And thank you to everyone who joined us. I'm just going to share my screen just to share. Here we go. So we have lots of other resources on the Osteoporosis Canada website. There's the nutrient calculator. This webinar is being recorded and will be available tomorrow. If you've registered, which those who are watching now have, you'll receive it in your inbox, and you can also find it along with others on the Osteoporosis Canada OC Replay webpage. And we also have lots of other interesting content on our OC podcast. Dr. McArthur has done some of those for us as well. So we encourage you to visit the website. The other webinars we have coming up, we have 4 more in May. Next week at the same time, we're going to be talking about golf for all you golf enthusiasts. The following week, we're going to be focusing on cycling, hiking, and soccer. And then we're going to take a break because the next day we're going to do a cooking demo. Turkey smash burgers with a green goddess spread. Join us with Emily Richards. Good protein, calcium, etc. Great strategies for cooking in the kitchen and getting the nutrients you need. And then the last webinar in this series will be on May 27th, and it will discuss water sports. So thank you, Dr. McArthur. If you have not subscribed to our newsletter, please do so. It's on the Osteoporosis Canada website. You can find us online on social, on Instagram, Facebook, YouTube Music, and LinkedIn. Thank you to everyone who's joined us. Have a wonderful rest of your day or your evening, depending where you are in the country. And Dr. McArthur, thank you so much. Have a good one, everyone. See you next week. Bye-bye.